Hello, this is the sixth of my video casts. It's Jules de Groot again, and today I wanted to talk about worries, primarily because what we know about people trying to manage this difficult time is that whilst there was a settling period in the beginning stages, now things are starting to change a little bit, but there are still those concerns about, so perhaps more heightened concerns about returning to work, how that will be managed, about if you're living with somebody who has health issues that you're concerned about, particularly I think for people not being able to see their families, and particularly if they have health concerns as well, and then they have to continue socially isolating under the Prime Minister's guidance, and all those kind of things really. And I think at this time, whereas initially we were perhaps, and I'm not trying to speak for people, but there was a general have to kind of get on and manage it, and a settling in period and trying to meet in different ways, doing things like this on Teams, was Skype now on Teams, and those kind of things, those virtual meetings. But I think as the landscape changes and it goes further on and doesn't seem to be getting back to normal, I think people's worries will be becoming more prevalent. So I think that's important for managers to think about as well, and how teams are linking, how they're linking with individuals, those kind of things, but also how we manage things ourselves. So what I wanted to talk about today really was something that you'll find on our website, and that is called a worry chart. Now, I don't want to in any way seem be inappropriate or patronising with this, but I think it can be very helpful, and I sometimes have to try and apply it myself. So I have been experiencing those things recently, and worrying about my family and whether I'm going to see my daughter who's pregnant, or our daughter who's pregnant and in her third trimester, and other people will have other worries. So one of the things that I find helpful, and I often give people in our clinics, is a worry chart. So it's a worry chart that says what are your worries, tries to note them down, and then how important are those worries? Are they really of primary importance? Are they, and more importantly than that, is trying to think about when they feel overwhelming, particularly this can be helpful. Are they a worry you can do something about? So is it a worry that you can deal with immediately, so you can do something to sort it out? Is it a worry that is there but you need a time to settle with it and let it come to you, and sometimes a solution will come to you, or a way of managing it will come to you differently. I find this about myself. If I let myself get overly anxious about things, I try to give myself time with it, because I'm not particularly good at responding to those things. I've said this in one of my previous video casts. And is it a worry you can do nothing about? So is it a worry you have no control over and there's nothing you can do about it? And I think trying to differentiate between those worries can be really helpful. Not only in the sense of perhaps talking them through, because obviously you can use our confidential counselling through Insights, that can be helpful, and they're open for referrals, and they'll do that via Skype or phone these days, but also maybe talking through with your family, with friends. Keep trying to link with friends, I think, is important, but also having that time yourself, some time. And one of the things about being in this position is that some people will have more time than others, but being in a family doesn't necessarily mean one has time for oneself, and then other people will be on their own and only have that. So for them, trying to link with other people and finding someone they can talk things through with to try and get a different perspective. And if you don't have that, please do contact our confidential counselling through Insight, available on our website. And if you have a problem, please contact the health safety and wellbeing admin team, and they will help you with that. Or of course you can have an occupational health referral through with one of us clinicians, and we can assist and support you with that as well, and tools and techniques, some of which I've been talking about in these video casts. But I hope you find the worry chart helpful. I think it can be helpful to sometimes get things down in a concrete way for some people, and then it allows one to work through it. So is my feeling about it, but obviously everybody's different, so I hope you find that tool technique alongside the other things I've discussed, particularly the mindfulness, the reframing, those kind of things. I hope you find that helpful as well. Okay, thank you, and please do again access our health, safety and wellbeing web pages. Our wellbeing team have been working very hard and making sure they're up to date, and they have lots of information available for you. And my colleague Liv and I will be very soon launching our Be Mindful About Mental Health 2-hour teach-in, so you can contact the health and wellbeing team to sign in for that. And for those of you who are managers who are struggling to manage any of these kind of issues, I will be running a shortened version of Well at Work, which is not a substitute for the whole day, but is a shortened version to try and assist you at this time, and then we'll be doing follow-up. So please do let us know if there's anything else we can do, and we have managers Q&A sessions as well, so please do let us know if there's anything we can do, and contact us. If you're not sure, contact us, and one of us will get back to you, either clinician or the admin team or the wellbeing team. Okay, thank you very much. Take care, and I wish you well.